So Dr. Matt Bentley, we're very honored to have him as our keynote speaker today. He is an environmental engineer and WASH technical specialist focused on improving public health and humanitarian response and international development. Until last week, Dr. Bentley worked at USAID in the Bureau for Humanitarian Assistance, leading global policy, practice, and research around WASH interventions in emergency response. He provided technical oversight and support to dozens of humanitarian partners across East and Central Africa, in line with evidence-based best practices and humanitarian principles. He received his PhD in environmental engineering for developing communities from CU Boulder, where he studied low-cost water treatment methods for removing pathogens and chemical contaminants in drinking water, wastewater, stormwater, and water reuse settings in the US and Southeast Asia. His keynote address is titled Principled Response to Sectoral Collapse. Now, before we give it away to Matt, if you have questions at the end, if we run out of time, there will be an opportunity to put them into Feedloop or connect with Matt afterwards. And if you're online, you can put them into the Zoom Q&A box. And translation services are also offered in French and Spanish. Now, take it away.
Hi, everyone. Thank you so much for being here. It really is an honor to be here at the WASH Symposium. Back in the day, when I was here at CU as a grad student, I helped to run the Symposium Planning Committee. So it's quite an awesome experience to return here as a keynote speaker. They must have been running out of speaker options to have reached this far down the barrel to come after me. But I'm really honored to be here. And you may have noticed that my title has changed from that which is in the program. My original title was Vulnerable Populations Are Not Your Laboratory. I was planning on talking about research ethics in humanitarian contexts and how development actors can work together with humanitarians on some of these issues. But given all the things that have happened over the past month and a half, I felt that it was necessary to address the state of our sector right now and provide a way forward, looking at humanitarian principles as a guide and as a pathway for us to continue advancing the WASH sector. So with that, my title is Principled Response to Sectoral Collapse, How Humanitarian Principles Can Plot a Path Forward for the WASH Sector. So up until last Friday, I worked for the artist formerly known as USAID. I was a WASH technical advisor and provided technical assistance to over 150 WASH programs across East and Central Africa, drafted global and national guidance documents for emergency WASH, including the Horn of Africa Drought Response Strategic Framework and Ethiopia WASH Capacity Building Roadmap, provided in-country training and field support on emergency WASH programs, led and drafted the research and capacity building agenda for BHA WASH, as well as a competitive award solicitation, which I know some in the room had applied for and unfortunately won't be moving forward, but was a great advance to try to fund some important work around operation and maintenance in humanitarian contexts. I provided technical oversight for 2 integrated public health research projects and represented BHA and the Global WASH and at Global WASH conferences and at the Global WASH cluster through technical working groups. And as was mentioned in my bio, I'm a proud alumni of CU Boulder. I really enjoyed my time here as a PhD student and postdoc, and I'm really glad to be joining here today. So let's get right to it. The collapse of US foreign assistance. We've seen over the past month and a half significant, seems like daily news breaking about USAID, foreign assistance, the future of our sector, future of WASH, as well as international development and humanitarian response. It all started January 20th with the executive order on foreign assistance and the 90-day pause for review of all programs. There were stop work orders sent, probably to some of you, as well as mass furlough and layoff of institutional support contractors. There was a life-saving waiver that was issued, and I put waiver here in quotation marks because this waiver was essentially meaningless. There was no action really taken to implement this waiver in a meaningful way because funds were frozen. Partners couldn't actually do work or get paid for it, and so this waiver ended up not really doing a lot. And the website went offline February 1st. On the 4th of February, nearly all workers were placed on leave. The USAID flag and signage were promptly removed. You can see here this black tape covering the USAID name on the Ronald Reagan building. And shortly thereafter, the USAID Inspector General was fired for highlighting some of the challenges that were inevitable from firing this many USAID staff members around oversight of US-funded foreign assistance programs. This was followed by large-scale official layoffs and terminations and reduction in force. Ultimately, we're looking at probably 95 to 98% of the USAID workforce that has now been laid off, including contractors. This was followed by a termination of around 90% of USAID programs. And then we heard that the 90-day award review was completed, which I think had about a 4-hour review period for each program, something like that, or 1 per minute if you're going by standard business days. So that review is interesting, we'll say, leave it there. But ultimately, we have about 17% of programs that are remaining that we know of. And in this last one, payment resumes for some programs. We're not really sure where, I've heard mixed reports around payment of some of these remaining programs. I've heard that some of the mechanisms are still broken. They're trying to figure things out. There are seemingly daily court releases and court filings around some of these things. So honestly, it's very hard to track all of this news. I did my best to compile it for you just to show you the timeline and really what's happened to the US foreign assistance sector. But this is just a very quick overview, glossing over much of the legal matters associated. And this loss of US WASH assistance in particular is quite significant. Looking at OECD, which is not the best measure, but is one of the only available data sets and such things, OECD estimates that the US contributed about 6% of the total official development assistance WASH funding globally. However, the US did make up 20% of WASH grants, not including development banks. So this was a really significant investment in the development sector. And those metrics don't include the humanitarian WASH side. And that's even more significant. So here, US humanitarian WASH assistance made up an estimated 60% of total humanitarian WASH assistance. The US was by far the greatest supporter of WASH programming and humanitarian response across just about every response globally. And you can see some of those charts on the right of the slide. So this is quite significant, this loss of funding. Other donors are also following suit and decreasing foreign aid. So we've seen around a 50% cut in US or in foreign aid from the UK, as well as a greater than 50% cut in humanitarian assistance from Germany, which had previously been one of the top donors behind the US. So ultimately, traditional WASH funding is trending downward very rapidly. This is the state of where we're at with recent events. Unfortunately, the timing couldn't be worse. We have increasing people in need due to the increasing severity and frequency of disasters, conflict, displacement, cholera and outbreaks, and reduced funding. So on the one side, we have decreasing funding. We have increasing people in need. We need to reach more people with WASH services than ever. And as many of you are aware of probably this figure from JMP, we are significantly lagging in our attempts to reach the goal of SDG 6. You can see here for basic drinking water, we need a 6x increase or acceleration in the rate at which we're providing WASH basic drinking water in order to achieve SDG 6 by 2030. These are dated numbers now. These are probably much larger accelerations than even in this publication now. 13x for basic sanitation and 16x for basic hygiene. So in the midst of this funding collapse, we have greater needs than ever and need to prioritize our funding and to be meeting these needs. There are still significant gaps, and this funding is only going to make that worse. I have a few reflections about kind of the state of the WASH sector I'd like to share with you. And the first is that we overcomplicate to our own undoing. In the WASH sector, we have a tendency to overcomplicate. Historically, we've had an over-reliance on randomized control trials, things like the WASH benefits and SHINE trials that were held up as the gold standard and as the things that will show definitively that we can achieve public health impacts and outcomes based on WASH programming. But it doesn't take an RCT to know that a community like this one pictured here in northern Kenya is going to see a health improvement through a WASH intervention by reducing reliance on contaminated surface waters like this livestock pond. We have an overemphasis on convoluted theories of change. Some of the donors have actually promoted this, and we have these extremely complex theories of change, log frame diagrams, and all the like that include just about every factor that you can imagine, overcomplicating our work. And this may upset some in the room, but systems thinking in some cases has been taken too far. Systems thinking is important. It gives us a way to understand how these complex systems operate, and yet we are limited. We are finite beings. Our organizations and our programs are limited, and we can't tackle everything. This overemphasis on the ability to measure public health outcomes negatively impacted donor wash support. So after some of these results were released, where we had elevated these studies to such a high level when they showed no impact, that really decreased the willingness of donors to support WASH, because they could see public health impacts through other means, and those certainly were prioritized. USAID had maintained for a long time a significant investment in WASH despite this, but it was certainly evident across the sector. And we've also seen a lack of focus on research that was field-led with high programmatic impact potential. Much of the WASH research has not been on areas that were issues identified at the field level that would have a high impact on existing programs and future programs, and we need to get back to that. We aren't as strategic as we need to be. The HDP nexus isn't nexused. I'm sure you've heard a lot about the Humanitarian Development Peace Nexus. We're not there. It receives a lot of talk, but unfortunately, this coordination is still lacking. However, programmatic overlap is increasing. So we're seeing humanitarian and development actors doing very similar programs in the same geographies because of the increasing frequency of disasters that are impacting existing development programs. A lot of these places are becoming even more fragile, and so programmatic overlap is increasing, but we're not seeing an increase equal to that in coordination. This is still a significant gap for us in the WASH sector. I believe WASH actors need to leverage their niche, and relatedly, understand the limitations of their organizational capacity. Development actors and humanitarian actors have unique skills and expertise, and they're different. They have different expertise, and it's important to leverage those and work together to achieve long-term impacts. And this coordination is needed to ethically program, particularly in fragile contexts where we see this occurring. One example is this water supply here in northern Ethiopia, where a humanitarian actor did an excellent job rehabilitating this and restoring access to an internally displaced population site. However, this was the third time that it had been rehabilitated for lack of repair. And unfortunately, they didn't have an exit strategy in place. And there was no plan for operation maintenance at the end of that humanitarian award. And this displacement was expected to last many years. And this would have been an opportune time for a development actor to step in and leverage their expertise around O&M, financing, and system support to support this community. We need to prioritize working together, but not doing the same work. This is a big problem that I see in the HDP Nexus space. And unfortunately, I fear that we're prioritizing programming with limited impact at times. We prioritize short-term band-aids over long-term solutions, things like water trucking, when we could provide a more durable water supply solution. We're working on this in the humanitarian sector, but there's still a tendency because of short timelines and budget constraints to prioritize these short-term band-aids. WASH is not a seasoning, and by this I mean WASH is not something we can sprinkle into a multi-sectoral programming to achieve public health impact. It has to be done well and intentionally in order to achieve public health impact. And if you just added in a little bit of WASH, you won't see much from that investment. WASH programs need to be targeted to address critical public health gaps. And if we prioritize everything, nothing is prioritized. So we need to focus on the right things. And I think right now we have a rare opportunity to reflect and to refocus. Spreading our programs thin means no impact for anyone. We see this very commonly in the humanitarian sector. I think it happens as well in the development sector in different ways, prioritizing lots of different types of programming, perhaps. But we need to make sure that we're achieving an adequate level of coverage and investment in order to achieve public health gains. So, in short, a recommendation is to get back to the basics as a sector. We need to be reminded of our public health focus, to focus on simple, not easy, but simple, impactful programming, addressing community and field level identified and felt gaps. and leaving our flashy research for another day. There's important research to be done for sure, but it needs to be coming from the field level, addressing those felt and identified needs. So quickly, overview of the state of the sector from my personal view. We see lagging progress towards SDG 6. We see a decreasing funding environment and decreasing priority from traditional donor countries such as the US, the UK, Germany, etc. Despite this, we also see significantly increasing needs due to disasters, conflict, water scarcity, outbreaks, displacement, and more. And we aren't well focused and are spread thin. We need to be more strategic than ever given our current operating environment. So with that, I would like to pose to you a few recommendations from a humanitarian. These are problems that the humanitarian sector has been dealing with for a while. And I think there are things that we can learn from the way that humanitarians have addressed these challenges around funding, around prioritization, around public health, that I think will be instructive for all of us today. So it's easy in this funding environment to be, and this political environment to be discouraged. I've talked with many of you over this morning and last night and over the past few weeks. It's easy to get discouraged. My recommendation here today is let's move forward together. Let's identify ways that we can move our sector forward in the midst of where we're at and continue to see impacts for the communities that we serve. And I want to propose to you a path forward. I'm not saying this is the only way we can move forward, but I think the humanitarian principles that I'm about to share provide an instructive way for us to evaluate where we're at and to identify what we should be prioritizing. So many of my students have seen this slide before. So apologies if this is review for you, but how many in here are familiar with the humanitarian principles? Can you name the 4 humanitarian principles? Okay, only a couple people, yeah. Water Mission in the back, shout out. And my students. So great, well, this will be very instructive for us all. There are 4 primary humanitarian principles. I'm not sure why the formatting messed up here, but they are humanity, impartiality, neutrality, and independence. Humanity, impartiality, neutrality, and independence. This is the part of my WASH class where I ask my students to make a guess as to what they believe these principles mean. Humanity is the principle that says all human beings are born free and equal in dignity and rights. This leads to the humanitarian imperative. Actions should be taken to save lives and prevent and alleviate human suffering arising out of disaster and conflict, and nothing should override this principle. This is the basis for humanitarianism. This is why it's called humanitarianism, is because of this humanitarian principle. It forms the basis of the rest of the principles. The next is impartiality, that actions should be taken or provided solely on the basis of need and in proportion to need. And this leads to the principle of non-discrimination. So we're identifying needs and we're addressing those needs in proportion to the need. That's very important. Neutrality says that humanitarian actors should refrain from taking sides in hostilities or engaging in political, racial, religious, or ideological controversies. This is certainly easier said than done, but is very important in the humanitarian space. I would argue in the development space as well. Lastly, independence says that humanitarian actors should be autonomous, meaning they act independently of other interests that might conflict with these principles, including political, economic, military, or any other non-humanitarian objectives. You can see probably pretty quickly that challenges will always arise when trying to adhere to and apply these principles in humanitarian settings as well as development settings, particularly fragile contexts. But I think they provide a sort of general roadmap for us for how we can be thinking about the current sectoral operating environment because we've been dealing with this for decades. So there are some things we can learn here. So let's dig into each of these, and I've got a few recommendations for us as a sector as we look at applying these principles in our programming moving forward. So again, humanity is the principle that says all human beings are born free and equal in dignity and rights. This is where the humanitarian imperative comes from. Some recommendations for you from this for us as a sector is to remember your motivation for WASH work. I love asking the question, how did you get into this work? Because every person in this room will have a unique and compelling story as to why they're here. We're all here because we care about the communities we serve. We've been impacted by our own life experiences and want to make a difference. And so remembering your motivation is really key. Understanding where you came from, why you're here. And I want to challenge you to make sure that this is your focus. The incentives in our sector at times can conflict with this principle. They can pull us away from the real reason why we're doing this work. So make sure this is your focus. Focus on life-saving work. Life-saving work most upholds the humanity principle and should be our top priority, because what is more impactful on providing or supporting this humanity principle than work that saves lives and alleviates suffering? Implement proven approaches to save lives and improve public health. If we recognize that all human beings are born free and equal in dignity and rights, we will recognize that they are not a laboratory for us to try new, unproven technologies and approaches. This is not our laboratory that we are the gods of, that we can decide what we will with people's lives. It's important for us to be careful, to do no harm, to implement approaches that are proven and have high likelihood for success, because we're dealing with people's lives. We should not be testing risky approaches on vulnerable populations lest we violate this principle. This is what I really wanted to talk about on my original talk today. And lastly, fight the good fight, focusing on the reason why we work in this sector. Don't give up. It's discouraging right now. It's hard. We have a long way to go. This is going to be hard to dig out of. There are significant impacts. We're all feeling discouraged, but keep fighting the good fight. We're doing good work. Next is the humanitarian principle of impartiality. Again, actions should be provided solely on the basis of need and in proportion to need. I think this will resonate with many in the room and some of the presentations later around data, because this really focuses on working to address WASH gaps where the needs are most severe, prioritizing the most vulnerable. But how do we know who that is? We have to collect and apply needs assessment data to prioritize communities and interventions. Data is really important as we do this, because we want targeted interventions that are going to address the most critical public health gaps for the communities we serve. And that's where the impartiality principle comes in. This will require all of you and all of us working with other organizations to identify the most urgent needs in our operational context, minimizing overlap, and addressing the most critical gaps in coordination with other organizations. This can actually be observed by way of example through the humanitarian cluster system. How many of you in here are familiar with the cluster system? Great, a few more of you than the humanitarian principles. That's excellent. So the cluster system was set up to improve coordination between humanitarian actors, to minimize overlap and to improve efficiency and effectiveness of humanitarian programs. So there's much that we can learn about this. And it's a very formal system, and there are ways you can informalize that to enhance coordination between actors to improve impact. And lastly, focus on the areas of greatest need to see the highest impact. If you want to see public health impacts in your programming, find the most vulnerable. Find the people that are experiencing the most critical WASH gaps and address those, and you'll see their health improve. All right, neutrality. This one is fun. WASH actors should refrain from taking sides in hostilities or engaging in political, racial, religious, or ideological controversies. My recommendations for our sector are to avoid controversy, to pursue neutrality. This is very important. Partisanship leads to distrust and reduced access. I might make some of us mad and maybe never be invited back to the WASH Symposium after this next one, but don't become a liberal imperialist in your attempt to reject neo-colonialism. Do you think your culture is superior to the culture of those you're supposed to be serving? Do you think the beneficiaries you're working with need to change their values and culture to align with yours? If you answered yes to one of those questions, you might be a liberal imperialist. Sorry to tell you. We should not be wielding WASH as a means of achieving our own social goals. And this leads us to the do no harm principle. So you get a bonus. Do no harm is another humanitarian principle, not one of the sort of top four, but forms another very important baseline for us in the humanitarian sector. So the do no harm principle says that humanitarian and development actors must strive to minimize the harm they may do inadvertently by their presence and by providing assistance and services. So under this do no harm principle, We have to assess and mitigate our biases, which is a lot easier said than done. We need to minimize the unintended consequences of our programming, planning for and preparing contingencies for when things don't go as planned. Especially now, given our current environment, development settings are increasingly fragile. Your programs will probably not go the way that they are intended to go. You will hit road bumps, and you have to prepare contingencies for that. Whether it's a natural disaster, a cholera outbreak, like we've seen in over 30 countries in the past year, conflict, and more. The do no harm principle also requires monitoring of our programming and engagement with beneficiaries with clear means for feedback, reporting, and accountability. Are you accountable to your beneficiaries? Do they have a means of reporting when things aren't going as they should? If something goes wrong, how would you know? This is really important as a sector. And this picture was taken on a field visit where a community meeting identified a critical problem with a water supply that we were able to address immediately in the field on site and immediately restore water access. If we hadn't had that community meeting, the partner had no idea that this was an issue. And so by talking with community members, having a feedback mechanism, they were able to report that they were still having problems with their system despite this expensive rehabilitation. Lastly is independence. Independence says that WASH actors should be autonomous, meaning they act independently of other interests that might conflict with any of the other humanitarian principles, including political, economic, military, or any other non-humanitarian objectives. As someone who formerly worked at USAID, this was a challenging one for us. You have to deal with foreign policy objectives and objectives that actually do conflict with humanitarian principles. This one gets really tricky, particularly with donors. And so my first recommendation is program based on the other principles. Don't just follow the money. Are you doing that program because it really is the best thing for that community, or because you think the donor is going to like your proposal more because you put that activity in? Expand your donor base with results-based programming in alignment with your org mission. You have to sell your organization to people based on the results that you're seeing in communities. There are some organizations doing an excellent job at this. We need to build resilient networks of support, and we need to consider alternative funding sources. And I wanted to highlight a project Evan Thomas and the Millennium Water Alliance are working on around carbon credits in East Africa for operation and maintenance financing that we were funding at BHA previously that I was very excited about. This was a project that was looking at alternative financing for operation and maintenance, which has constantly been a thorn in the side of humanitarians for years. And it was looking at innovative financing and ways of funding this outside of the traditional donor mechanisms, which was very exciting. So we should be really considering what are these alternatives? Now that we know that foreign aid can be turned off, just like the faucets that we install, we need to be looking at what are robust and resilient ways that we can fund our work. And we need to break out of the need for US foreign assistance to survive. So I'll end on this slide. We can move forward strategically as a sector to maximize our impact despite a complex and uncertain environment. Significant WASH funding may now be lost, or it could be redirected. There's a lot that's still to be decided. There's breaking news every day, it seems, as to the future of foreign assistance. So we're going to have to keep tracking this. But it's important to consider the significant WASH financing and funding that may be lost as a result of the current political environment. Secondly, WASH needs are increasing due to more frequent and intense disasters, conflict, water scarcity, and outbreaks. We need to build this into our programming. Expect this to happen and understand that the needs are increasing. We need to be more strategic. So we need to think strategically to maximize our impact. And like I've said through this talk, I think the way to do that is by applying the humanitarian principles because they provide a way forward to maximize our impact in a limited funding and hostile political environment by addressing the most critical public health needs in vulnerable populations. With that, thank you for your time. I really appreciate you all being here. I'm happy to answer some questions. I don't know if I'll have the answers to everything, but happy to engage with you all. Thanks.
I really appreciate the honesty and humility and candor that you approach the topic. Can you provide some suggested areas for us to focus on, removing areas that we have to be honest are not as essential as we'd like to think they are?
Yeah, that's a great question. So what can we remove to focus on what's most important? I think that's going to depend a lot on where you're working. I think if we apply the impartiality principle and the focus on public health, life-saving assistance, that provides a way to identify what those activities are. So we should start with robust needs assessments. Where's the greatest need? What are the wash gaps here? And then we should focus on addressing those life-saving gaps. And that'll look different. I don't want to say any particular type of wash programming is, we should just cut completely, because it's going to depend. Rural, urban, different regional contexts will have different nuances that need to be worked out. But using these principles as a roadmap, I think, is the way to go to identifying what those critical programs are and what can be cut. Thanks.
Hello, Deacon Joshua Knight with Catholic Engineering Corps, and I really appreciate your presentation and the work that you've done. I got an easy and a difficult question. The first one, you talked a lot about prioritization, and you just touched on that now. Is there like lists of like different things that we can look at, like percentage of diarrhea in a certain community, like lists of different things that are good criterion for, for what is, how can we prioritize? And the other one, I think there's a little bit of a conflict. I know in the work that we've been doing, we're actually looking for more commitment from the community, right? To where we're maybe not looking for the poorest of the poor, because they're not going to be able to maintain it. So we actually look for a cash contribution. And that's one of our criterion is, can they make a significant cash contribution? And that's not going to be the most needy. So anyhow, if you could address those two questions. Thank you.
Sure, and I'll address them as a humanitarian. So I'll start with the second and go back to the first on sort of the who to target and some of the challenges around reaching the poorest and the most vulnerable. I think we need to find ways to deal with that issue. And that's honestly where I think some research may be needed. I mentioned the carbon credits, carbon financing idea. If the most needy communities aren't able to pay for services, we need to figure that out, whether it's funding from those governments and having them prioritize operation and maintenance. If it's alternative models, I think we need to focus on that, because if our goal is actually to achieve public health impact, we should be focusing on the most vulnerable. The first question on how do we identify who that is and what programs are most important? I think diarrheal illness is as you mentioned, a pretty good one. Where are people experiencing waterborne disease, and where is that disease burden most significant? That's a good place to start. You can also look at metrics like water access, particularly in the humanitarian sector. We have standards around a certain level of water supply that we need to achieve in order to say that we've met a minimum standard, 15 liters per person per day in most cases, sometimes less, which is not a lot. So metrics like those can help us identify where should we be focusing our resources for water supply, potentially sanitation, hygiene, water quality, those sorts of things. Yeah. Thank you. Bonnie.
Thank you for being here. I am with the WASH Planning Committee, and I am asking a question from online. So this question is, thanks for the summary of the collapse of USAID funding. Do you have any insight on which programs had resumed payments?
That's a great question, and I don't. This is very much a developing story, and I've heard things from people, but a lot of the information right now is unverified. I will say that if you're reading the court filings, for instance, there's been a lot of things said that are not exactly true in those court filings, particularly from the government right now. And so we're relying on partners to tell us if their funding has resumed, if their program has been terminated. There's been a significant lack of transparency and communication around these issues, which I can now say now that I'm a free agent. So that's a big issue, is who's left, what programs are still around, is anyone receiving funding? I think those are still open questions. Honestly, some of you in the room may have better insight on some of those than I do, as as you have active programs or had active programs and may know others that may or may not have received funding. So unfortunately, I can't answer that question very well. Thanks.
Thank you. And I had a question for myself, which is, now that the USAID funding is, just pulled out of the sector, who would you expect to be first in line, I guess, to step in and fill that gap? Where do you expect funding to come from next?
To be honest, I don't see that gap getting filled. And I know that's really a sad state of affairs. But to be honest, I don't think there's a way, if the US indeed reduces its foreign assistance funding and eliminates 90% of programs moving forward, I don't see that gap getting filled by anyone. However, I do hold out a bit of hope that Congress may one day do their job and require that funding that is appropriated by Congress is actually spent for foreign aid. Well, that remains to be seen. But I'm certainly trying to track that and want to see that happen. If that happens, who knows who's going to manage all of that? That remains an open question too. I would say though, for organizations that are thinking about this lack of funding, you need to sell yourselves to people. There are a lot of people that are seeing this collapse in funding and want to do something about it. There are many people writing Congress and doing collective action and things like that. Now's a prime opportunity for you to sell yourself to the American people that you're doing good work that should be funded. And I believe that if you do that, it won't fill the gap, but Americans will likely open their pocketbooks to support you if you can demonstrate that you're achieving results through your programming.
Okay, so my question is about what advice you would have for future generations who might be entering this workforce and navigating the difficulties already that could, and how those will impact us in the future.
It's a great question. Thanks for that. And to be honest, it's a challenging one. I've been thinking about this over the past few weeks, not only because of my own now job search and career trajectory, but also because of all the people that I know who have lost their jobs. I think there's great opportunity actually to work in a parallel sector that allows you to gain skills that will transfer to a future WASH sector should one survive and continue, which I believe it will. I think there's going to be a rebound at some point. And so finding a way for you to stay in a parallel sector, whether that's water consulting, whether that's working with NGOs and working on the program side, whether or not it's WASH, I think there are ways for you to, and for students to get jobs that will contribute to a future career in WASH, even if it's not WASH-specific jobs in the short term.
I wanted to ask if you had any. I wanted to ask if you had any predictions for WASH funding and development in the medium to long term, like 5-10 years from now.
I don't like to gamble, so no. It's just so hard to predict right now. I will say that up until very, very recently, a month and a half ago, this sector has been very bipartisan. And so that gives me some hope that I do think that this will return in some way in the future. I don't know if it will be at the same level or what the priorities will be, but I am expecting that things will rebound. I have no way to predict, unfortunately, the funding landscape, what that will look like then. But it's a good question.
Could I also ask, you mentioned not wanting to test, to use untested methods on vulnerable populations. I'm curious how you would propose developing new methods of humanitarian aid.
Yeah, good question. There's a lot I could say on this topic. That was my original talk plan. So maybe we should touch base after. But I do think there are ways when issues and strategies are arising from the field level where there's a need, identifying things that have worked in a parallel context that can be tweaked and applied. They don't necessarily need to be proven in a humanitarian context before you test them. They can be proven in a development context. They can be proven somewhere else and transferred in an intentional way. You can't take one approach and just drop it in and expect it to work. Humanitarian and development assistance is inherently different, such that should not be how it's conducted. Yeah, there's a lot more I could say on that, but I'll leave it there. Thank you. Thanks, everyone.